A study was conducted that showed 39.6% of patients ages 13 to 17 were rehospitalized at least once, with females being more likely for readmission. And this percentage soared in the 2000s. So this study was conducted in Norway, but compared it to global statistics, and it's pretty fully encompassing and aligns directly with the rest of the world. So what do we really do with this information? What does it mean? Why was there mass increase? And it most likely means because of the development of technology and the mass amounts of stress and inflation in our world and all of the violent crime and drug usage that was occurring, mental illness was more likely to be brought up. It was more likely to be produced or amplified if it was already pre-existing. And psych wards have not been properly adapted for this. They have not changed their methods, and it's only becoming worse. So new problems require new solutions. We know this, and humans are creative enough to be able to do that, but it's just not happening because of lack of funding or lack of care. So I'd like to move into personal recounts. These are stories coming from myself, people that I know, as well as research papers or articles that I've seen. So the lack of dignified respect in these facilities really leaves a mark on you as a person, and you begin to question whether or not you're as human as you thought you were. I would like to begin with a few tidbits from my own story. So at the age of 15, when I was forced to go to the mental hospital because of New Mexico state laws, and I was infamously sent to the worst one, or I was sent to infamously the worst one in the state, and those stories held true. Their reputation really held strong. So I was not greeted by my name. I arrived at 3 a.m, and I was not talked to as an equal. I was forced to strip, to take any medication they handed to me without telling me what it was. I slept on a rock-hard bed with a blanket that was so thin, if you held it up, it was see-through. And it was January. And in order to get another blanket, it would take approval from a doctor. And that average wait time was usually 2 to 4 weeks. So you're freezing the whole time. So these were a few of the more minor aspects of living there, but I like to say this as a precedent. So would you take a 15-year-old child with a terminal illness and force them to freeze, sedate them, and treat them like a delinquent? No, the answer is never. So a study in Iran, or UK, I don't know how to describe it, but I think it was a study from the UK in Iran. And it was devised to showcase the dignity level shown to patients, and they interviewed patients, psychiatrists, nurses, and the family members of the patients. So you were able to get kind of every perspective, which is really helpful. And the answer differences are so miraculous. Even basics such as knowing your diagnosis, which is a right, was not shown. And violations of HIPAA were all throughout this research paper. These quotes showcase the exact scenario in which people were not provided with their diagnosis. Patient: I was hospitalized several times and took many medications, but I didn't know my disease's name. Psychiatrist: knowing the diagnosis alone doesn't help. They may search the internet and it could confuse them. Another psychiatrist: I don't think knowing the diagnosis is very helpful, but if they ask, I'll tell them. There should be a system that provides the necessary education. Counterintuitive. I'll leave it at that and I'll let you think about it yourself. I would also like to touch on two stories that were supposed to be my argumentative pieces. And one of them is from an article labeled "The Family Throughout the Therapeutic Wilderness Process, Our Stories." And it tells the tale of a teenage boy who ended up getting into substances and dealing with a mass influx of anxiety and depression, and he was sent to one of these treatment programs and was not about it at first. He didn't want to go, and then he ended up having a really good experience and further developing his relationship with his parents to the point where he went back after about a year or two of going back to high school because he felt that he was going down the wrong path again. So he readmitted himself, which I thought was really fascinating. I've never heard any story like that before, but I am happy that it worked for him. And the other story is from somebody in my life who would like to remain anonymous. And he started this out because he was like, I think that's such an interesting topic because I had a really good experience. And as we worked our way down, halfway through, we kind of stopped. He's like, I'm kind of thinking this was worse than I thought. So the reason why he went to the psych ward is because he checked himself in for 72 hours because he didn't want to deal with going home to his ex-husband because he was extremely high on substances. He was dealing with severe addiction at this time. So after intake, the staff didn't interact with them at all, only provided them with playing cards and a TV in the community room, and that was their form of entertainment for those 72 hours. They didn't give them any medication, anything to deal with the withdrawals. They didn't give them any therapy. They were stripped and given hospital gowns. There were 2 beds in every room, and their blankets were just as thin as mine. After 72 hours, he talked to the doctor for 15 minutes, and he just discharged him, said, "Goodbye, you can go." And that was the only time he talked to a mental health professional. There were no resources that they were given. They didn't ever mention rehab or 12-step. They just called him Mr. last name, and it just felt very cold and distant. They had to designate curfew time, just hospital food. Before being placed into his room, he had to wait in a holding cell in a padlock lock room for a couple hours. It was just extremely unhelpful, and he came to that conclusion by the end of it, and in his reflection, he was like, wow, I went to this place years and years ago and thought that it was super helpful, and looking back now, they did me so dirty. I'm paraphrasing him on that because he said something very close to those. So, I digress. Let me move forward. I know this speech may seem very optimistic and, completely demolishing our system that we have put in place and fueling all this money and energy and time into it, but I think it's so worth it. So worth it. It doesn't need to be tearing down every mental health institution, but we have the capability to ensure better lives for our every average day civilians, for everybody on our planet. And even things such as reducing pharmaceuticals is so helpful. And I would like to state that here. So a pharmaceutical-free experiment was enacted in Norway, and it showed vast improvement for patients in their cognitive and societal function. And instead of providing them with large doses of drugs to subdue their mind and their symptoms, which also just subdues their entire personality, they gave them programs where patients could interact with other patients and they could begin to build bonds and connections and understanding of one another, as well as largely implementing therapeutic devices and having the therapist really take their time to get to know the person and invest themselves in their lives to properly aid them and give them proper coping mechanisms. And with that, they formed communities, and they felt like they were actually normal people who didn't need to exist with a pill. And this wasn't just for less severe mental disorders, which like depression, anxiety, so severe, terrible, but it stretched as far as mental health conditions like DID and schizophrenia, which is just remarkable that they were able to go unmedicated and had a better experience. And that just proves the point that so many people are extremely over-medicated and under-therapized or under-educated. So, I feel that this would reduce readmissions as proven in this study and create more consistent and stable lives for those people. And one of my favorite quotes that I have ever heard, and I'd like to wrap this speech up with this. Forgive me for my stutter. It comes from a TED Talk about addiction called "Everything We Know About Addiction is Wrong." And I believe it fully applies to mental illness as well. So this is paraphrasing, but it goes something like this. All this time we've been singing addicts' war songs, when instead I think we should have been singing them love songs. The isolation and detachment of people with mental illness from our society is a critical mistake that needs to be left in the past. They're the ones who need the most attention. They're the ones who need the most connection. And our prestige as a society must be washed away for the livelihoods of our friends, our families, our children, our future. Working towards a less medicated and more emotionally educated world is the ultimate goal, of course. Psych wards and wilderness training programs must be held accountable for the damage put upon people and reformed to a better state. And please do your research if you're struggling or have been put through abuse in these institutions, and don't be afraid to speak out and enact change, because doing so creates awareness and connection with others. Thank you.